Hello, and welcome to Animal Chiropractic Clinic Chatter, a podcast where Dr. O from All Creatures Every Spine interviews doctors and animal owners that utilize animal chiropractic to get their unique perspectives. Yes, it's really a thing. Dr. O utilizes his 30 years of experience as both an animal chiropractor and veterinarian, and to dig deep into the discussion of complex issues affecting the lives of your animal friends and companions. Join us for this educational episode. Thanks for joining us for this portion of the episode as Dr. O begins to answer the question, what is animal chiropractic? He will look at how the chiropractic adjustment is a valuable and viable treatment for what ails your animals.
Hey, what is animal chiropractic? Animal chiropractic isn't veterinary medicine. It's not chiropractic. It's not body work. It is similar to veterinary medicine. It is similar to body work. It is similar to chiropractic. But it's not any of those. It is a separate entity. Animal chiropractic isn't about moving bones. Animal chiropractic isn't about curing lameness. Animal chiropractic does those things. It's not about relaxing muscles. It's not about, improving gait. Animal chiropractic does those things. Animal chiropractic is the identification and removal of vertebral subluxations that create nervous system interference. This nervous system interference causes the body to not function at 100%. The body's not functioning at 100%. It can't counterbalance. It can't correct itself when it's falling. It can't digest its food properly. It can't respond to thunder in an appropriate manner. All kinds of things that go on. So, an appropriately trained animal chiropractor isn't going to do muscle relaxation. That's not the goal. It may be a side effect. It's not going to improve the gait. Might be a side effect. Better digestion, side effect. Calmer horse, calmer dog, side effects. All those things might be side effects because all the certified animal chiropractor is trying to do is remove the vertebral interferences to the nervous system to restore nerve flow to 100%. So that then the things around can happen. I had a gentleman this weekend talk to me about how if you had, one contractor come in and fix a cracked pipe and another one come in and reseal the caulk around a window and then 6 months later a different pipe cracks and another window is needs recaulked and how that you can just go on and on and on. But if you go in and really look at what's causing those pipes to crack, what's causing the caulk around the windows to start to fall out, maybe it's the foundation. And so when somebody goes in there and corrects the foundation, then the windows stay caulked. The pipes don't crack anymore. The doors swing freer because the problem wasn't the caulk, the door that was sticking, or the cracked pipe. The problem was the foundation. And it's the same with animal chiropractic. The problem isn't the bilateral muscle. symmetry. Asymmetry. It's not the lack of digestion. It's not the lameness. The problem is the interferences in the nervous system. The problem is the foundation of every function in your animal's body is related to its nervous system. When you have a certified animal chiropractor come out, look at your animal, they're going to look at things like that. They're going to know which side of the nervous system is having problems. They're going to know where the nervous system is being interfered with. It may be a long ways from the problem. It may be right close to the problem. But when they remove that interference, your animal's going to feel better. It might last a day or two the first time. That's okay. Because then the second time, it should last 4 or 5. And eventually get up to where, depending on what you're doing with your animal, it's lasting an appropriate amount of time. The animal's able to hold his adjustment. Yep, our goal is to get your animal addicted to chiropractic care. To get your animal addicted to feeling the best he can be, the best she can be. To get your animal addicted to feeling great. To being the best companion it can be for you. Whether that be a lap dog or a champion dog. Whether that be a pasture ornament or a 1D barrel race. So, remember, the body heals only one way: above, down, inside out. Keep your animals adjusted. Have a great day.
Make sure to visit our website, allcreatureseveryspine.com, where you can subscribe to the show and learn more about getting your animals adjusted. If you are in the Meridian, Texas area, drop in on a Tuesday afternoon to get your animals adjusted. If that isn't possible, schedule a consultation on your animal's health with Dr. O. You can also purchase a copy of Dr. O's book. Yes, it's really a thing.
Standard Process is a third-generation family-owned company in rural Wisconsin. You could say we just make nutritional supplements, but we know we're changing lives. We grow ingredients on our own certified organic farm without pesticides or herbicides because we think they should be as close to nature as possible. Quality is our priority. That's why we do everything right here, from hand-picking the seeds to delivery, so you know exactly what goes into every bottle.
Your active dog needs more than water to rehydrate. Replenish Dog Water Supplement is an all-natural powdered water flavoring, prevents dehydration and provides vitamins for your dog. Created by a veterinarian and rooted in science. Give your dog the care they deserve with Replenish.
Join us as Dr. O interviews a certified chiropractor, veterinarian, or an animal owner. These enthusiastic people explain how they utilize animal chiropractic to alter the lives of the animals in their communities.
All right, everybody, welcome to another episode of Animal Chiropractic Clinic Chatter. Who is Animal Chiropractic? And as we all know, Animal Chiropractic isn't about us. It's not about Dr. Amy and I. It's about those of you out in the field that are using and utilizing and adjusting every day. Today we have Dr. Stephanie Parent with us.
Hi.
Hi. Tell us a little bit about yourself, ma'am.
Okay, so I was in the military, got out. I was medically retired from the Air Force. Went to Texas A&M, did the undergrad there. I went to Texas Chiropractic College. And then in my last year of TCC, I started going to Dr. Amy and Dr. O's wonderful school. And I tested for the ABCA board test that first year and passed. So I was board certified throughout, really the entire time.
Cool. All right. So, why chiropractic? And then first, and then second, why animal chiropractic?
Yes. I have to mention, I remember sitting at the table at your house, and I was not even a chiropractor yet. I was still in school, and I made a comment to all the other students there saying that I really never wanted to be a human chiropractor. I wanted to go straight into animal chiropractics. And one of the people there said that was the dumbest thing in the world, because he's like, why would you be a chiropractor and not want to work on people? And I was like, well, I want to do animals. And he's like, you have to establish yourself as a human chiropractor before you can even do that. And I was dead set. I was like, nope, I'm going to go. I'm going to do animals from the start. And I'm so glad that I followed my gut.
Yes. All right. And you can do that. And we have a lot of students that do that. And I think it's an awesome mindset. And, if you truly... but why chiropractic? Why not veterinary medicine?
So there's a couple of reasons for that. So I was retired medically from the Air Force. I was in a car accident, and I had about 21 pelvic fractures, multiple back surgeries, multiple hip surgeries. And I was told by the doctors at Tinker that I would likely never walk again. And the general on base was a chiropractor. And this was before we were really allowed as active duty service members to have chiropractic done. And so we would go in after hours and he would adjust me. So within 6 months, I was walking backwards with a walker. And within a year, I was actually doing PT again. I did not get medically retired until I re-broke my hip years later and had to have a third hip surgery. So, but that was one reason. And the second reason, I could not put animals down. So I could not deal with it. I knew that the mental health was really, really bad in the veterinary side of things. And even at Texas A&M as a marine biologist, I did not have that feeling like I wanted to go the veterinary route. When picking schools for chiropractic, I wanted to go with the more evidence-based school. Luckily, TCC was about 20 minutes from where I lived. And they were a very sports medicine, evidence-based school. And I'm glad I went there. But when I went to your house is when I learned a lot of the philosophy behind it. We learned it more at TCC from a history base. We were not a very philosophy-driven school, but it was important to get that philosophy background. And I actually got more of that from you and Dr. Amy. So that's one reason. And really another reason is I'll get emergency appointments, but it's not very common. So, excuse me. And I like the chiropractic side because I can make my own schedule. I don't have crazy emergency hours. And so really it's kind of the best job. Yeah,
You get to spend all day that you want to, as many hours you want to with animals outside. So
yes.
Anyway, so tell us a little bit about what are some of your most memorable cases with animal chiropractic?
Okay, so I'll have to preface that I am about 95% equine. So I've had a lot of very interesting horse cases. My most memorable one, though, it was a dachshund, and her husband was active duty, and they were on their way from one state down to Texas, and they stopped here in Colorado because the dog ended up hind-end paralyzed. Brought her into the office, completely hind-end paralyzed. She had just had a C-section about 3 months earlier and had a litter of puppies. And after, I want to say 4 adjustments in a 2-week period, she was walking again and had no problems after that. And that has happened probably 3 other times, but that was one of my first canine cases. And that was amazing. Just watching the dog go from not being able to use any hind end to being able to live a perfectly normal life. And it's kind of sad because since then I've met many people who've had dachshunds or corgis and they've had the surgery done. 6 to 8 months later, they're still recovering. And I'm like, dang it, if somebody would have just told you to try this approach, you could have saved thousands of dollars potentially, and you would not still be recovering 6 to 8 months later. So that was the most memorable one. With the horse, God, there's been so many. It's kind of learning patterns. That's been, I would say it's not one case, it's learning patterns, learning that different breeds of horses, different jobs, you'll see a lot of the same patterns. And then it's very easy to explain to the owner, like, hey, this is why I'm seeing this, and this is how we're going to fix it. And that's great. So I wouldn't say there's one case equine related, but that one dog case was just amazing.
Yeah. And so, sorry.
No, you're fine.
One of the things that you mentioned was that if somebody had only told them.
Yes.
And that's one of my big things, especially now. I firmly believe that Riley is dead because I didn't know.
Yeah.
And Riley is my 37-year-old son, but nobody told me when he was born, maybe we should take him to a chiropractor. And even after I started doing chiropractic and I started doing, adjusting, and he was going to the chiropractor and I'm adjusting dogs, and that's all we do for a living. And somebody came in 3 months after he died with a dog that had a seizure. Actually, I had 2 dogs come in on the same day that had just had their first seizure. And I was told, they said, well, should we start him on seizure medications? The veterinarian wants to start him on seizure medications, but we don't know. What do you think? And I said, man, let's do chiropractic. Let's start a seizure schedule and see what happens. Because one of the side effects and one of the problems with seizure medication is you can't get off it.
Yeah. Yeah.
And it's just like with steroids and back surgery, and once you have back surgery, you're going to have more back surgery. And I feel that the biggest problem with chiropractic is people don't know about it.
Yes. Now, that being said, I've had 3 back surgeries. Most of those were done because at the time I was active duty. And it's funny when you see your diagnosis go from one thing to now I have the diagnosis of failed back surgery. So that's what I am. I'm a failed back surgery.
Yeah. So you're a failed back surgery, but you walk pretty good. So
I'm great. Yeah.
Yeah. So anyway, yep. That's so cool. So what do you wish the animal owners, we've talked a little bit about it, but what do you wish the animal owners in your area knew about animal chiropractic?
Well, luckily, being in Colorado, a lot of people do know. So that's been kind of great. But one thing I've realized, especially on the canine side, is if I ever have a dog owner that calls me and they're like, hey, this is going on, I don't know if I should try chiropractic or go into the vet. And you get the owners who are adamant about going to the vet. And I'm like, okay, you know what? Go ahead and go. And I guarantee you they're going to put them on a steroid. They're going to give them gabapentin or Neurontin, and they're going to give them some sort of pain medicine. It's going to be a non-steroid anti-inflammatory, or it could be something like Rimadyl or Tramadol. They're going to give you those 3 medicines. And they're like, okay, well, what does that mean? And I'm like, that means they don't really know what's causing it or what's going on. So when you hear those 3 medicines, give me a call. And 9 out of 10 times, they'll call me either that day or the next day, and they're like, yeah, they gave them 3 meds. So, but I do tell owners all the time, I'm like, it's what's great about being a chiropractor is that we only really have one tool. We can't run all the diagnostics in the world. We can't take all the tests. So we have to really use our brain to figure out what's going on and it's like putting on your thinking cap and trying to diagnose a problem. So that's, I think, what makes a good chiropractor too, is being able to diagnose. So that's pretty much what I've been very lucky about, is I'm very good at diagnosing and trying to figure it out. That being said, I also know when I'm out of my scope of practice. So if I'm out of my scope of practice, I'm like, no, this is something that's not chiropractic and you need to go to the vet. Yep.
Yeah. I'm amazed. Well, we use, I am a vet, but we use the adjustment as our major diagnostic tool.
Yeah.
and we adjust and they get better. Okay.
Yeah.
So what was the problem? What was the vertebral subluxation? Causing nervous system interference, resulting in some sort of organ function, dysfunction. That's what was causing the symptoms that you were seeing. And we removed that. And that's what I'm always amazed at. We use our diagnostic tool as the treatment, or our treatment as the diagnosis, however you want to look at it. And you get, I had somebody that went and we'd been adjusting their horse's lower neck for a year and a half.
Huh?
And if we adjusted every 4 weeks, the horse did great, performed well, got upper A level, dressage, did great. All right.
Yeah.
But if it was a 5-week month and there was a show in that 5th week, terrible, and so they were worried, and they went and they spent $1,400 on a bone scan and found out that there was some arthritic changes in the lower neck, and they were fine. And so the reason I know that is because when we called to make the appointment for their monthly checkup, they were like, well, we're going to have to wait, doc. I said, okay, why? Well, because we spent $1,400 on bone scan, and we don't have the money right now. And so I said, oh yeah, what the bone scan find? And she told me. I said, well, yeah, that's where, if you go back and look at the records, we've adjusted that particular area every month for the last year and a half. She goes, yeah. And I said, what did they suggest? Well, they didn't really have any suggestions. I said, so $150 a month, diagnosis, treats, and the horse does great.
You asked me a while ago what I wish owners knew, and you just kind of brought it up there. I always tell people that chiropractic can be very good preventative maintenance. So that's one thing too. I'm like, actually, we'll go into another thing. I'm like, I'm going to change the subject. Sorry. I'm going to change the conversation. So arthritis, everybody's afraid of arthritis. And I have to explain on a weekly basis that arthritis sometimes can just be a normal aging process. It's not that scary. It's like the word neurological. It's not that scary. So, but the horse owners think it's like life ending. And I'm like, no. So that's one thing that I do talk about a lot. And I wish that, I don't know where they're getting the ideas that neurologic and arthritis are such bad words, but I'm like, no. And you really just kind of got to explain it to people. But yeah, it's, God, I run into that problem every time that they ended up going to the vet, spending thousands of dollars, and now they don't have that money to do the chiropractic, and the horse goes downhill.
Yep.
And the test is something we already knew. So, sorry, continue.
Well, no, and neurological, one of the reasons that, veterinarian, before I started doing chiropractic, I hated neurological cases, which now that I know chiropractic, I know what chiropractic does. It's all neurological.
It's all neurological. Yes.
And I can fix it. Whereas veterinarians really don't have anything, for neurological cases, except for surgery. Refer them to the neurologist. They're going to do surgery, or those 3 drugs that you talked about.
Yeah.
And what amazes me is the side effects of those 3 drugs are often what we're treating for. Number one side effect of gabapentin is an uneven gait.
Yeah, it's uneven gait and proprioception problems. I'm like, that's what we're treating.
Yes. So yeah, it gets kind of confusing there. So anyway, yeah. So what, we talked about your cases. So how about doctors out there, that are either kind of on the fence about going to adding animal chiropractic, what would you tell them?
Okay, so I'm going to go a little bit about Colorado, first of all. We moved to Colorado 2018, and I opened up practice here. I never practiced in Texas because I essentially moved as soon as I graduated. So I've only practiced here. The way every state's different, and the way the state law here is written, I believe it's Senate Bill 18-239. But to be an animal chiropractor, you either have to be a vet or a chiropractor. Vets are really technically not allowed to say they do chiropractic. I think they're supposed to say they do spinal manipulation, but they can take a weekend course if they want. They can go to a school like yours or one of the other certifications if they want, or they don't have to do anything. So essentially, they don't have to have any formal training in chiropractic. And then as for chiropractors, you do have to have that base 120-hour course to get your license, because we do have a separate license.
210.
Oh, is it 210? Okay, so thank you. So yes, you do have a separate license for animal chiropractic, but only for chiropractors. But no one is required to be certified through the AVCA, IVCA, none of it. So most of them, I would say, are not certified, or they are IVCA certified. There's a couple of VMO. There is a handful of AVCA certifications out here. And really, I think it's because if you don't need to do it, why put the money behind it? And as for the vets, they really don't have to do much out here to even add it to the list. It drives me nuts. The weekend class stuff drives me absolutely nuts, because you know who went to the weekend class because they only do three things. They adjust the pelvis, they adjust the something in the pole, and then they adjust some ribs, and that's it, because that's what they learned in the weekend. Now, I disagree with it for two reasons. First of all, it's just no training, but also, how do you learn the technique of performing an adjustment in a weekend? So how do you know all the angles? How do you know every facet angle, or how do you know every angle of every joint? How do you know how much pressure and force to put behind it? What direction to push it in your line of drive? You can't do that without repetition. And I don't understand, without any training, how you're even getting it. But the chiropractors, if they don't have to be certified, then why do it? Because essentially that's more continuing education. It's more money to get the board certification. And so most of them don't. Now that being said, I love being AVCA certified out here, because essentially I don't have to advertise. It's people come to me every week. People come to me. And it's like I was telling you earlier before we started the conversation, out here, I would say probably 80% of the English horses, they will not use you unless you are board certified through the AVCA. So really competition's kind of low.
Cool.
And yeah, so I think it's very important to do it. I always tell people, I say, if you're going to get plastic surgery, would you go to your primary doctor? Would you go to a board certified plastic surgeon? It's kind of one of those, and you never stop learning. Continuing education is so incredibly important, and things change. And essentially, I love being AVCA certified. I wish that there was more regulations out here. With that Senate bill I mentioned, it allowed chiropractors to essentially bypass needing a vet sign-off. And that was great. As long as it was just equine and canine, we could do that. But a lot of people have taken advantage of it, because it's like, do the bare minimum and get the license. So, yeah.
Yeah, we see that all the time. We have people that come and they want, the bare minimums all the time. And
yeah.
And, one of the things that we do here is, you said repetition. We make sure everybody gets a lot of repetition when they come to class.
You know how many times I've heard you say repetition is key, and the key is repetition? What?
Yep. We just keep going over and over and over. Muscle memory,
yep.
Right? Because, there's a lot of times with horses where you don't have time to think about that. You were talking about the angle of correction, the line of drive, how much force, and there's times where in class you can set up, and you can do here, and you can move over a couple inches, and you can do this, and you can change, and
you can completely change it. Yep.
And then you're like, okay, thrust. But there's times in the real world, where you better be there.
Yeah. And it's funny because some people ask me, how long would it take to adjust a horse? And I'm all the first time it's always longer, because we're going to go over a full exam. We're going to go over, because I tell people, I want you to understand exactly what I'm finding, why it is the way it is, and how we're going to fix it. Right. And then we're going to go over some exercises to essentially help you prevent this from happening again.
Yep.
But and they're like, what about the second adjustment? I'm like, sometimes it takes 5 minutes and sometimes it takes an hour. You really don't know, because horses can be complete jerks. They can run around. They might be terrified, or you get the ones that'll stand perfectly still. So sometimes it's just, you got to be quick to get it all done.
Yeah. And sometimes, like, we have some dogs that the faster you can get them done, the better off you.
Yeah.
Oh yeah. They come in, and I've got one dog that they come in, and if we don't adjust him like within the first 2 minutes, then we're probably not going to get him adjusted, because he sits there and he gets scared, and so the more we talk, so we have to talk. The owner has to tell me all the new stuff before they get there, or after we get or almost while we're after them, and then say, hey, by the way, all this. So sometimes. Now I do have a question for you. Do you get the cases, dogs or horses or whatever animal, where you have to have the owner leave? Because I get a couple of those too. Oh yeah. We've always had that, and I think all veterinarians and anybody that works with animals has that. And then we have some that backfires, and you're better off. The only person that can hold that animal is the owner. Yeah. And that's just experiment, and you have to be flexible. You have to be willing to go, and sometimes you don't know until something happens that, that dog needs to be, or that horse needs to be held by this person and this person only, and then everything is smooth after that. So but and then, don't hurt my dog. Well, your dog already hurts. What do you mean? Yeah. Nobody's, well, here, you touch right here. And so they'll touch right there, and the dog will scream. And then but how'd you know that? Well, because I could tell that was sore. And I'm going to have to put my fingers there to make it better. And so we might yelp. And, well, can you go slow? I always ask, how do you want me to take your Band-Aid off? Yeah. You got a Band-Aid over your hair. Do you want me to take it off in 3 or 4 days, or you just want me to me just get it done? So anyway, I hear you have some exciting news that you might be looking for some help. Yeah. Okay, so we were so incredibly blessed when we moved here in 2018. I had an office for a very short time, just because I came across a whole bunch of chiropractic equipment when I was graduating. And after COVID hit, something told me it wasn't going to be like a 10 days to flatten the curve thing. So essentially, I had put the office up for lease and sold as much as I could. It was just a rented building. So I had dropped the human side of everything in 2020. I think it was like April of 2020, and I went completely mobile. That was the best decision of my life, because I did not want to deal with the politics and deal with the trying to keep the office open. I was only in the office about 1 day a week, just to do dogs and a couple of people. And I had an associate working in the office at that time. And then I'm going to backtrack a little bit. When I moved here, I worked 7 days a week. I worked 3 or 4 days in the office, and the rest of the time it was out in the field. I would start with sometimes 3 horses a day, sometimes 20. But it was essentially 7 days a week for over a year. And
So 2020 went completely mobile. The only, oh God, what's the word? Hold on, sorry. You're going to have to cut this out of the recording because I can't think of the word. What's the word? No, not assets. Sorry, Bill.
Okay.
I know. Okay, whatever. So essentially, the only bills I have, the only stuff I have to pay for is the gas and the mileage on the car.
Mm-hmm.
That's what I was thinking of. So that's it. I have a bail, expenses, whatever. So I have a bail. I have an portable table in the car, and I have me. And then I have software and stuff like that. Luckily, my husband designed it, so it doesn't cost me anything. So I'm so glad this is not live. Hold on. Okay. So after 2020 and we went 100% mobile, essentially I did not have a lot of expenses. So I was 5 to 7 days a week, I was doing equine. Every single day that I work to this day, I have 2 to 3 new patients, 2 to 3 new people, I should say, with animals. So I am continuously growing. And we kind of started taking the money we were making and get more into the real estate side of things. And about 2 months ago, we decided that we want to retire because we were lucky, we were blessed, we were doing so well from out the gate that it was, let's see if we can get some real estate money coming in and then keep growing the business. And essentially, let's see how big we can go. And I'm to the point now where I can hire another doctor because I'm just too darn busy. Or it was, do I want to do that? Or, you know what, we're doing good, so let's just retire. I'm also a retired veteran, so I'm always getting money through the VA. So essentially, we're at a point now where we can just stop working. And so I went from wanting to hire an associate just to kind of expand the business, because one chiropractor can only do so much. We
That's
all
right.
run out of time. And now I am now to the point where I'm like, you know what? Let somebody else do this. The business is profitable. We have never had a month where we were not profitable since day one. And it just keeps getting bigger and it just keeps growing. And we want to essentially let somebody else do it. So we are thinking, the big news, I guess, is that we want to sell the business. It's like I was talking to you.
But you're willing to have somebody work and buy it as they go.
Absolutely. Yeah. So before we started recording this, we were talking, and I was saying it's not very easy to sell a chiropractic building or a business because we don't really have any of the assets. We just have the bell and the portable table. We don't have an office. We don't have staff, but what we do have is a huge client list. And essentially we have a method, because I have taken what you taught me and then what I have learned over the years. And now we have tweaked it to this way where it's very easy to explain. And we've talked about this before, where it's almost streamlined at this point. I can go over an exam that I can teach people. I can teach people how to do this exam. I can teach people exactly how to, like, what to tell the owners of the horse or the dog, and the rehabilitative stuff, but also kind of what to do. And as long as I can teach them, and then they're going to learn too, because again, you never stop learning. It should stay profitable and it should keep growing. And yeah, so we're not going to be, yeah. So sorry, one more thing. So
no, that's fine.
Because we don't have, oh my gosh, you're going to have to cut this out. I'm sorry.
Well, so one of the things is, and we're going to have to stop anyway, because I have a 40-minute and then we'll come back. Then we'll come back. So, but one of the things that I think what you're trying to say is that we have we teach Show Me Chiropractic. We give you the tools, and we teach you a beginning protocol to start with, and then you tweak it. And it's repeatable. Doesn't matter if it's me adjusting it or you adjusting or whoever's adjusting. It's the protocol, and it is chiropractic. And it's when you get out of chiropractic and start doing other stuff, like a beamer. Oh, this one needs a beamer, and this one needs this, and oh, this one needs this little massage here.
Yeah, that's great and stuff.
Yeah, then that's when it's not repeatable anymore.
Yeah.
But
in regards to what you were asking, yes, we are looking to hire somebody to essentially take over the business and to buy it out from us. And I don't know exactly how we're going to do that yet, but if anybody knows anybody that wants to move to Colorado and take over, then yes, we can work with them.
All right. So let's remember, the body heals only one way and one way. Above, down, inside out. The nervous system has to be free of interference in order for that to happen. Thank you so much for today.
You're welcome.
For this interview. We appreciate it. And until next time, keep adjusting. All right.
If you are or know a veterinarian or chiropractor, or a student of either of these professions, visit our website, Animal Chiropractic Education Source, to see how to become certified in animal chiropractic. Start improving the lives of the animals around you. Thanks for tuning in. Be sure to subscribe to the ACES channels so that you never miss an exciting episode.